When I first found out that I had the brain tumor, I was, I believe, 22 years old.
So my brain tumor diagnosis started about a year ago.
She came to us initially with a visual deficit and a diagnosis of a tumor that appeared to be benign on scan and turned out not to be.
I remember thinking, there's railroad tracks. I need to at least cross the railroad tracks.
Unfortunately, he had a massive seizure while he was driving.
I had driven over a mile and don't remember a second of it.
We provide comprehensive care. We provide the most up-to-date clinical trials, and we provide it in a very personalized setting.
I'll give Dr. Sung credit for being very good about keeping me calm despite having brain surgery.
The less anxiety you have related to this huge brain tumor surgery you're about to have, then the faster you're going to recover.
You know, here I am at the farm working where I've wanted to work my entire life, and you know, it's just, everything's been great.
Cody did it really well. I think with a well-executed plan, with a good surgery and good involvement and input from all the oncologists, this type of care, this type of outcome can be expected and should be expected.
Yeah, I can't say anything besides thank you to friends, family, Dr. Sung, Sarah Beam.
Renee's case was a very typical case that we encounter from other institutions, where a large craniotomy is performed, where a large incision is made. In her specific case, an incision from ear to ear to access a lesion that is centrally located between the eyes.
When Dr. Sung saw her in the office and saw her scan, he recommended that we try a transsphenoidal approach, which would be no incision at all, going up her nose into her brain to remove the majority of that tumor surgically without an incision.
And so we use this advanced scopes that actually can look backwards, where we can take out tumors in previously inaccessible areas.
I just really felt like they had my best interest at heart, as opposed to some of the other doctors we had talked to who were ready to get in there and get it done the old-fashioned way.
Renee had a short recovery time due to our minimally invasive technique, avoiding the ear-to-ear incision, and is one of our main goals of providing this option in patient care. One technology that we offer is BrainPath, which is a way to navigate the folds of the brain to reach deep-seated tumors and resect tumors safely with causing minimal pain, achieving better clinical outcomes. Patients have to seek a center with the experience to treat all types of conditions, not only the commonly treated ones, but also the rare conditions.
While they're dealing with the diagnosis of a brain tumor, the last thing they want to have to do is be looking up in the yellow pages, well, who should I see for radiation and who should I see for chemotherapy, when we know who the best is in town and we work closely with them.
So it was nice to be able to come, just 45 minutes as opposed to 2.5 hours away to Chicago. And especially when you're recovering from something like a brain surgery and then later, dealing with the cancer part of it, you don't want to have to. You want to be as close to home as possible. It was greatly reassuring to have that.